I think the heart of Uplift is that we don't want anybody to feel alone or in a place of despair where they just have nothing to live for. The growth of Lexington County has just overwhelmingly rocketed in the last few years.
Lexington, I believe, is the second busiest emergency department in the state of South Carolina. Recently, we've had over 50 patients waiting for medical beds. It's sitting in the emergency department.
We go to civil disputes and mental health crisis every single day, multiple times a day, and just try to help people through. Any chance we get to rehabilitate the community instead of detaining them or charging them, we're going to take it.
These patients where we're all interacting with them, law enforcement is, EMS is interacting, the ED, and we're interacting with them, but there's not a cohesive plan. And so having this team really helps.
Uplift is an organization or a coalition of individuals that come together to divert individuals with mental illness out of the ER and criminal justice system by placing them into systems that help them more long-term. Serve and Connect is just a piece of the puzzle. We have about 58 organizations within our network. They're groups that include mental health, aging. We also have different organizations around counseling, around food, around homelessness. We're not there to reinvent the wheel. We are there to lean into individuals who are already doing the amazing work that they're doing. And why not get to know those individuals and lean into them when we know we need a resource?
Emergency departments have become location where patients come to when they have a behavioral health crisis. What this does is say, we don't have to have the emergency room patient come to us if we can meet their need in a lower level of care.
We have 2 community paramedics that are out there right now working with high utilizers. We come together as a group, and what we do is we talk about those high utilizers. We understand how many people are coming into law enforcement hands or the ER, and we're able to identify those individuals.
Part of Uplift helped to fund a position for us in which we could send out a mental health professional with the EMS community paramedics team. They handle more the physical health stuff. We're there to assess and manage the mental health, and so it makes for a very good partnership together.
There's been a couple times when we go up and knock on a door at somebody's house, there's a little bit of apprehension. And then once we explain why we're there and we talk to them for a while, it's like these walls just come down and they just flood you with information, and you can tell how much they've been hurting or they've been struggling or they just don't know where to turn. We want to enable them to take different avenues.
We've had individuals that a big barrier was transportation. So they were calling EMS every 2 weeks to get a shot for their mental health challenge. We were able to actually coordinate an avenue for us to be able to actually go into the home and administer that medication.
We have other options to offer people than an ambulance bill and a hospital bill or a jail.
Well, I got into this job to help people, and that's point blank what I signed up to do. It always feels good to just give back to your community, and any organization that's willing to help us is greatly appreciated.
So I think it's a vision that I wasn't ever sure I would see in my lifetime. Everybody sitting at the same table, everybody coming together to say, we all want the best for this patient population. How do we do that together?
It is okay to not be okay, and that's a lot of the things that we say to individuals. We're not there to pass judgment. We are there to lean in and to listen and to show them that there are still people out there that care about them.
Mental health is not a quick fix. It takes a lot of patience, a lot of compassion, a lot of empathy. We're kind of there to hold hands and to say, what is it that you need in this moment? Uplift offers so many avenues of resources. It's nice sometimes just to slow down and try to meet a stranger and meet them where they're at.